I'm Kat and I'm part of the conference committee, and I will let you do your introduction.
Sure. Hi, Kat. I'm Dr. Usha Tummala-Narra. I'm a clinical psychologist, and I live and practice in Boston, in the United States, in Boston, Massachusetts. And and I'm a psychologist in practice at the Danielson Institute at Boston University. I'm also a research professor in psychological and brain sciences at Boston University. Most recently, I was professor at Boston College, and I also have a small private practice. My areas of research concern immigration and trauma and cultural competence in psychodynamic psychotherapy practice. And I have been in practice for over 25 years and involved with teaching and research as well.
Wow, that's a lot. That must keep you busy. And have you had any thoughts of what you would like in the area that you present at the conference to be, or what is your current kind of research focus or area of interest that's going on for you?
Yeah, one of the areas that I've been very interested in, as this is a pluralistic counseling conference, I have been thinking about talking about how I integrate multicultural issues, sociocultural issues broadly, and social context in psychoanalytic psychotherapy. And so one of the areas that I have been working on over the past many years is on making cultural competence a core aspect of psychoanalysis, psychoanalytic psychotherapy. And so the perspective that I bring integrates multicultural, feminist, and psychodynamic concepts. And so I will be talking about that integrative perspective as we approach counseling and psychotherapy.
Sounds so interesting. And I can see how pluralism fits really well into trying to take all those different perspectives and not kind of having the one right answer, but taking a bit of everything to try and make sense of that, I suppose, that intersectionality that's going on.
Yes, exactly. And if we think about just the complexity of human life, and so we think about intersections of identities and social location, but also how culture is dynamic and changes across time, and how each of us, even if we belong to or affiliate ourselves with a particular community, a cultural community or a religious community, how different each of us experience those communities, how culture is a very individual experience as well as a collective experience. And so in this perspective that I will be talking about, I will be addressing culture from a complex a sensibility and trying to think about individual experience of culture, and also how broader sociocultural traumas and oppressions influence the negotiation of identity, and how we come to see ourselves in relation to the larger world around us.
I really love what you just said there, the kind of, well, the almost inner cultural and the outer cultural, and how those two things are both separate and together at the same time. I can really see that, I guess, with the pluralistic stance, the inner plurality and the outer plurality as well.
That's exactly right. Yes. And even within psychoanalytic psychotherapy, there are so many different models of psychoanalysis and psychodynamic thinking. And so I will also be bringing some integrative perspectives with regard to psychodynamic concepts. So thinking about classical theory, but also more contemporary relational models of psychoanalysis, and trying to see how concepts from each of those models really help us understand contemporary issues such as racism, such as sexism, homophobia, and how those things interact in the psychotherapeutic relationship. So how the broader social context actually has impact on how a client and a therapist interact with each other.
That sounds like so much to try and hold in your head in the counseling room. I'm almost trying to imagine trying to hold all of that. And when you're talking about the kind of psychoanalytic, I don't know if I'm going off on a tangent in my head, but I'm almost thinking of the kind of ego states and those kind of different parts of self, and how that would really, I'm not quite sure, kind of sit with all that kind of inner and outer plurality, I guess.
Yeah, because so much of our experience is both conscious and unconscious. So so much of it lies outside of our awareness, in addition to what we're experiencing in the moment, and that's right in our conscious life. So this perspective that I'll present really tries to integrate both of those layers of experience.
I suppose we've probably covered my second question. That was just the first, but it was kind of what interests you in presenting at the Pluralistic Conference, and what kind of most excites you about pluralism as a whole, or the pluralistic philosophy.
Yeah, I think that in order for us as therapists to really understand a person more fully, that we need to draw on pluralistic thinking. We need to draw on multiple perspectives to really understand a whole human being to the best of our abilities. I don't know that that's truly ever a possible endeavor, trying to understand someone fully, but it does bring us closer to looking at a whole person rather than only symptoms or only a diagnosis or only things that are that reflect suffering. So, pluralistic model, in my view, really helps us understand suffering and resilience, and trying to understand how context really plays a role in shaping suffering and resilience.
That sounds so interesting. I'm so excited to listen to your keynote talk. And
thank you so much.
Thanks again so much for doing this today.
Thank you, Kat.